All right, it's Live 1015 Valleywise Health Give-a-thon. It's our second annual, and with me right now I have Kendal Gribler. She's an advanced clinical nurse at Valleywise Health. Kendal, thank you so much for being here, for doing the work that you do, and just personally for myself and on behalf of the Live 1015 team. Thank you for your selflessness that you and your peers have displayed this year. You guys are truly heroes.
Thank you for having me, Natasha. And I guess I don't want to say you're welcome, but this is my job. I wouldn't choose any other profession, and I know a lot of my coworkers feel the same way. So, proud of the work that we're doing.
I also wanted to thank you for being a part of the patient's family. During this time where there's no visitors allowed, you are the visitor in the room with the patient. Can you share some of those stories and moments of hope that were essential for the family, as well as the patient, not only, for them, but like just the community around you guys? You guys had to build that.
Mm-hmm. Working in an ICU, especially like these times now, the patients, most of them are intubated and on mechanical ventilators. So like you say, yeah, you're the clinical nurse, you're the patient's advocate, you're that line of communication between the patient and their families. I feel like when you're like in the midst of it, like at work, I'm fine. Then there's like in the song Story, when you heard like the part about reading the last rites. So like that day I was holding the phone and I had it on speakerphone, and the chaplain, our hospital chaplain, who's wonderful, she was reading last rites to this man who his family had made the decision to withdraw care, and she's reading his last rites and she's saying the Lord's Prayer, and I'm holding the phone in one hand and holding his hand with my other hand, and I've got my mask on and like face shield, full head to toe PPE, and thankfully, because I'm like sitting there bawling my eyes out. And I mean, it's like things like that, like it's get emotional for things like that. But most of the time, when you're there, it's just doing everything that you can in your power to help. So, but moments like that, I get teary eyed.
Yeah, I guess, well, I was going to say that reflecting kind of like even on the magnitude of just that even particular situation, that's not an isolated situation.
Mm-mm.
And that's like the saddest thing. My great grandmother passed away earlier this year from COVID-19 as well, but she was in a nursing home, and she had pre-existing conditions, and that was the hardest part, is just knowing that just basically like her last year was alone.
Mm-hmm.
So yeah, I'm very thankful for frontline workers like yourself that have provided that warmth.
Yeah. No tears. Oh, I know it's been a weird year for everybody, and the end of life situations like that are never easy, and this has just made it all the more difficult for everybody.
Mm-hmm.
So I know myself and my coworkers take that part insanely like seriously. We just, it's hard, and nobody wants their loved one to die alone. And I can assure you, anybody that is entrusted to my care will not. I mean, hopefully they make it out. But in those cases where patients like have pre-existing conditions, or they make the decision to withdraw care, like I will sit there for hours and hold hands and everything I can.
I just want to hug you. I want to say thank you. Right, air hug. That's what, it's all about in 2020 and moving forward. I appreciate the time you have taken to not only, dedicate your life to helping others, but to sit down and talk to me. The call to action for people to donate right now, Valleywise, from the staff to the patients and all the work and care that they provide, could use your help. You can text all in AZ to 91999. That's all in AZ to 91999. Kendal, thank you so much.
Thank you, Natasha. Happy holidays.